Hello everyone and welcome to Breast Week. My name is Kate and I am the breast skills tutor. I hope you've all had a lovely week off and have recharged those batteries. This is just a short video that's just going to give you some information about your week. If I am looking up and to the sides, it's because I've written lots of notes here just to remind myself of things, because there are quite a lot of things for me to tell you. Okay, so we've had to make a few changes to the timetable this week because of the bank holiday. So normally we would do all the teaching on a Monday morning, and that would then go into the afternoon with the radiology talk, and then we would meet on Friday and go through the theme case discussion and then get you all signed off. However, this week, because of the bank holiday, you will be going straight out onto clinical placement on Tuesday or have your self-directed study day. So the first time we will meet will be Friday morning at 9 o'clock at the Nightingale Centre at Wythenshawe Hospital. And on Friday, so I will be taking you through some talks that we would normally do on Monday. So they will include a talk about triple assessment, which I'm sure you are all very familiar with now, and I hope you've all had exposure to in clinics. I will take you through a talk about the principles of treatment and signs and symptoms of breast cancer and how to make a diagnosis. And then there will be a practical session with myself and one of our lovely clinical fellows, and we will take you through how to carry out a breast examination, which you will all have done this week. So Friday will be pretty much a whole day of teaching, okay, with the theme case discussion and sign off in the afternoon. So before you go out to clinical placement, I strongly recommend that you visit One Med Learn, okay, get a cup of tea and get nice and comfy, and have a look at the pre-placement breast resources. Okay, there are several of them and they are all fabulous. So please have a look. In addition, along with this little video, we have also sent out the slides from the benign breast disease talk that again we would normally have given you on a Monday morning. And there is a link for a video that's about 40 minutes long, which is all about breast radiology, which is again, it's really, really good. That's been recorded by one of our lovely breast radiologists. So when you go out to your individual placement sites across Greater Manchester, that will include Wythenshawe, Wigan, Bolton, Tameside, North Manchester, Oldham and Macclesfield. So what you can expect is to follow our doctors into breast clinics. So you will be examining patients, you'll be taking histories. You should have exposure to 2 clinics, so a new patient breast clinic and a follow-up clinic as well. You will also get to shadow our surgeons in theatre and hopefully assist with some cases. And what we would like you to do, so a task that I think is something that's really valuable for you to do, is to follow a patient. And by this, what I mean is, so follow a patient either through breast clinic, so it may be a patient that has found a lump, they've gone to their GP has referred them into the breast clinic, and you meet them when you are taking a history, carry out an examination and then follow them through the breast clinic. So follow them to have a mammogram, an ultrasound and maybe a biopsy. And whilst you are doing this, chat to the patient. So ask them about their experience, you know, how they felt. There will be a lot of anxiety and worry that you will experience this week from patients that are coming to breast clinic, whether that's for new appointments or for follow-up appointments that might include results. So there will be patients that are extremely worried. I think it's really good for you to talk to them and find out how they are feeling, and ask them questions about their experience. So, what is their diagnosis? What procedures have they had so far? What have they had done? So, ask them questions that focus on them holistically. So, how has the diagnosis affected them and their family? What's that impact? And also, is there a message that they'd like to give you as future doctors, or back to us as a team, whether that be a positive message or maybe some feedback? And that can either be good or bad feedback. It's always really good for us to have that patient feedback. And then when you've managed to follow a patient, again, that can be in theatre as well. So it may be that you've spoken to a patient before they've gone down to theatre. So you've chatted to them about how they're feeling on that particular day. And then just to write, doesn't have to be pages or an essay. It can just be a couple of paragraphs just reflecting on that experience, and you could then use it if you wanted to talk about on Friday when we have our little debrief. So if you could do that, that would be really good. So just to recap before you go out onto practice, so these are things that we'd like you to do. So have a look at the pre-placement breast resources on OneMed. Watch the radiology video. Have a look at the benign breast disease slides. Before you go into theatre, make sure you have a good breakfast. Theatre it's a whole day for you, and depending on some of the cases, they can be quite long, so make sure that you've had a good breakfast on that day. I look forward to seeing you all on Friday and hearing about the week and having a chat about it. If there are any questions or anything that you want to ask or anything you've not understood in the week, just write them down and we can go through them on Friday when I meet you. But most of all, enjoy the week. I really hope you have a good time. I will be sending out some extra information for the Wythenshawe and Macclesfield students, and that's all about breast theatre. So there will be an additional email alongside this one. And something I just want you all to keep at the forefront of your mind before you go into clinical practice this week is to remember that breast cancer is very, very common. The lifetime risk for women is 1 in 8, and there are 56,000 new breast cancer diagnoses per year. The incidence is also rising, which we will talk about more on Friday when I see you. But whichever area of medicine you decide to branch out into, you will come across women who are maybe going through a breast cancer diagnosis or who have had breast cancer. You will encounter somebody along the way. So it's very, very important that you are able to recognise those signs and symptoms of breast cancer, know how to refer and how that referral process works from the GP and also from the NHS breast screening programme, and that you are aware of treatments, etc. If you have any questions before your placement, you can email me on kate.tomkinson. So that's kate.tomkinson@mft.nhs.uk. So I can't wait to meet you all on Friday and find out how your week has been, and also if there are any of you that are now thinking about becoming breast surgeons. I would say that at least one of you goes into the week and thinks that it's something that, or maybe you haven't thought of being a breast surgeon at all, but on the Friday there's at least one of you that actually now is strongly thinking about it. So I look forward to hearing all about it on Friday. So have a lovely week, Take care, and please get in contact if you have any questions. Okay, thank you. Bye.